Well, this is Eric Ankerud with Heartfelt Dreams Foundation, and I'm very pleased to introduce Dr. Ami Bad, Director of the Adult Congenital Heart Disease Program at Massachusetts General Hospital, for our webinar series presentation today. Dr. Bad.
Great. Thank you so much for having me, and Happy New Year to everybody. Today we thought this would be probably a good time. This is being filmed in January of 2021, and a good time to talk a little bit about COVID-19 and the heart, because I know many people have had questions. We're excited because we also have some very recent data that just came in about adult congenital heart disease, COVID-19 and the heart, that will be published in the next several weeks. But the authors have shared some of the preliminary information, so I will share that along the way as well. So to start with, I always like to start every lecture lately with reminding us how we prevent the spread of COVID-19. 20 seconds, soap and water or a hand sanitizer, avoiding close contact with people who are sick. 6 feet we've gotten used to, covering your mouth and your nose when you're around people. And remember that symptoms can take 2 to 14 days to develop. So please do self-quarantine in case you are in contact with anybody, so that if you develop late illness, you haven't exposed more people. Reminder, when we go into public settings, or if people outside our household are near us in an indoor setting, to please wear masks. And these are some of the primary symptoms for you to take a look at and remember. So the COVID-19 vaccine, I thought I'd start right in with that, and then we'll back into talking about COVID and the heart a little bit. On December 11th, the FDA issued what we call an emergency use authorization for the Pfizer vaccine for individuals age 16 and older. And then December 18th added an EUA for the Moderna vaccine, which is for individuals age 18 and older. Please remember, both vaccines require 2 doses, and they have a great efficacy of around 95% across many different demographics and comorbidities. The EUA is worth talking about. What's different about it than the normal vaccine approval process? So the EUA is a mechanism to facilitate the availability and use of medical countermeasures, including vaccines, during public health emergencies. So essentially, these 2 vaccines got the EUA because they meet an effectiveness standard, and they do have a favorable risk-benefit profile. So we didn't cut corners in giving them approval through the EUA. However, the FDA does expect that both these manufacturers will continue their clinical trials and eventually pursue the formal FDA approval, and we expect that to happen. How do we know the vaccine is safe? So the vaccines which completed the phase 3 trials were given to 30,000 to 60,000 people. Now, as of mid-January 2021, we have vaccinated millions of people. And so this is, clear evidence that we are doing the right thing. There was a safety monitoring board that made sure that the vaccine was effective. And in general, interestingly, only about 50 to 60% of vaccinated people need to be protected for a vaccine to be considered a success. So we're looking at 95%. These are great vaccines. These are different than the vaccines that we've been getting. These are called mRNA vaccines. And they're now being approved for the first time, but just so people know, they have been studied by researchers for decades. They don't contain live virus, so you can't give someone COVID after you get the vaccine because the vaccine gave it to you. Some vaccines are live attenuated viruses, a version of the virus, but a weak one. This is not at all that, and I'll explain exactly what it is in a few slides. And then please don't worry, mRNA vaccines do not interact with our own DNA in any way. Side effects. Adverse reactions were a little more common after the second injection than the first in the studies. Rates of adverse reactions pretty similar between Pfizer and Moderna. And the most common reactions, and I had these when I got my first dose, was injection site pain, so kind of soreness in the arm or the neck area, fatigue, maybe a little headache, maybe a little muscle aches, joint pain, or chills. Last maybe a day and a half and then go away. The side effects were generally considered mild to moderate, resolved in a few days for almost all people in the trials. And we've seen that in real life practice after the first and even after the second vaccine. People are really starting to feel better within a day or two if they do have some of these effects. Is there anyone who shouldn't get the vaccine? So the vaccine shouldn't be given in combination with another vaccine. So if you're getting another one, please wait at least 2 weeks to get the COVID vaccine. Allergies come up a lot. I thought this would be a good place to address it. So for individuals who've had a history of allergy to a vaccine, or those who have had an allergy to any component of the current vaccine, and that you can look up online, or we're happy to give you that information, those people should see an allergist before getting the vaccine. However, if, like me, you have a food allergy or you have a drug allergy, you actually don't need to worry about getting the vaccine. If you've had anaphylaxis to food or drug before, they are recommending that instead of sitting for the 15 minutes after the vaccine to be watched, you may want to extend that to 30 minutes just to make sure that everything's okay. So people do ask, if I had COVID already, do I need the vaccine? Aren't I protected? So the answer is you should be offered the vaccine regardless of whether you've had COVID-19 in the past or not. You're not protected simply by having had the disease previously. Nobody's going to ask you to have an antibody test or anything like that. That question has come up. If you're currently infected with COVID, you should wait to get vaccinated until your illness is resolved, and then please check with your doctor to talk about timing. And if you do have COVID currently, it's generally uncommon that the first 90 days after having COVID, the disease, you're going to get reinfected with the virus. This was before different variants of the virus existed, so I'll just say that as a caveat. So again, if you're infected, obviously your PCP should know, your adult congenital heart doctor will want to know, and then make sure that you talk to your primary care before you get the vaccine. There are questions about pregnant women getting the vaccine. There are studies that are ongoing and enrolling now. There is not evidence from the original trials, but in general, the obstetrics group are saying pregnant or lactating women who are otherwise eligible from the current vaccine deployment phase could receive the vaccine, even though we don't have safety data. So if you're pregnant or lactating, please consult your physician and think about risk benefit. If you're somebody in phase 1, which is people who are really healthcare providers, perhaps working in a COVID environment, the risk benefit may favor your getting a vaccine. Cold chain storage has come up. I just wanted to mention it in case people have questions. A big difference is vaccination storage conditions. The Pfizer vaccine requires very cold storage. Moderna is a little bit more stable, just under standard freezer and fridge. However, please know that there are other vaccines that require cold chain storage. So the flu vaccine, MMR, the hepatitis vaccines, polio, all of them have required those as well. And we've been able to do it for other vaccines before. I put in a slide about vaccine deployment. This is local to Massachusetts. It changes consistently in certain places, and each state has their own. So please look up the CDC and then the link to your state to look at where we are in deployment. Last important question. Do I need to wear a mask if I've received 2 doses of the vaccine? And the answer is absolutely yes. So it is still important to cover your mouth and nose with a mask, wash your hands often, stay 6 feet away from others. Once you get the vaccine, the 95% efficacy means that if you were to get the disease COVID, you would barely know it. You really wouldn't be able to tell. But we don't know if you can still carry asymptomatic COVID. You get COVID and then you are walking around with it, because then you could give it to friends, colleagues, family. And so again, the vaccine itself does not give you the disease. The vaccine protects you from having a bad episode of COVID. We do not know yet if the vaccine protects you from even being an asymptomatic carrier, meaning you could still be a vector that gets the disease and gives it to someone else, and it's just that you never got sick from it. So please keep wearing your mask, keep distancing. We're not going to be out of it for the rest of this year for a little bit. So COVID-19 and cardiovascular disease. These slides are courtesy of Dr. Aragam, who works with us at MGH Cardiology, and he did such a beautiful job that I borrowed some of these. So a few things to think about. What is the risk of cardiovascular disease for getting COVID-19? What is the risk in the setting of having COVID-19? And what is the risk of what will happen after COVID-19? And then we'll talk about some delayed hospital presentations in an AHA campaign that I think is really important called Don't Die of Doubt. So if you have cardiovascular disease or adult congenital heart disease, are you more likely to get COVID? No. you're not more likely to contract the disease because you have congenital heart disease. If you have cardiovascular disease, might there be increased risk for you if you do develop COVID? So with older age general cardiovascular disease, there may be some worse outcomes, admission to the ICU, mortality. However, they're really not sure because those are older patients with general coronary artery disease. They may have other organ system issues. They may have weaker immune systems. We can't extrapolate this data to adult congenital heart disease because we're just not the same. We'll talk a little bit about the new data that came in a few slides. Let me just talk to you about why COVID even affects the heart. So COVID-19, a little bit of science, enters human cells when its spike protein binds to this receptor. So you can see these blue things are spike proteins all around COVID. You've seen the COVID pictures everywhere in the news, and they attach to this receptor. And so that's actually, how it gets into lung cells, but it's also how it can get into other host cells like heart cells. This spike protein is what is attacked in the vaccine. And so that's what the vaccine is actually aimed at. It's aimed at the spike protein, and that's the focus of the COVID vaccine. That ACE receptor, very present in the lung, which is why there's so many lung effects of COVID. However, you can see it in the blood vessels in the heart, and that's why we think that there are some of the cardiovascular complications of COVID that we see. So how can COVID affect the heart? You can get increased blood clotting or kind of a whole body illness, and you can get a heart attack from blockage of arteries. That has been reported. You can get injury to the heart muscle itself, the virus itself, the stress of being sick, or increased inflammation can all affect the heart muscle. And you can have arrhythmias or funny heart rhythms, oftentimes because the heart muscle has been affected. So what do we see? In terms of mechanisms, the heart cells themselves can get injured by the virus. The immune system can just be off balance. You can see more inflammation, more blood clotting, and kind of a severe whole body illness. Cardiac complications, we talked about heart attack, heart failure, or arrhythmia. There are also vascular complications. So that can include stroke, blood clots in the legs like deep vein thrombosis, or even blood clots in the lungs. And so these are the things that we watch for. Again, fortunately, these are not common, but these are the more rare complications and severe complications of COVID. What about after you get COVID? So let's say you have the disease. What can happen later? So it turns out that there's a study of 100 patients who recovered from COVID-19, and they all had a cardiac MRI. Now, they didn't necessarily have any heart effects during COVID. However, about 2 to 3 months later, we decided to look at their hearts. In that, about a quarter of those people still had some symptom. We call them the long haulers. They had shortness of breath, fatigue, with common things like household chores. And on cardiac MRI, we saw 60 patients who had ongoing inflammation in heart tissue. So if you notice, 100 patients who had recovered from COVID were studied. About 25 had symptoms, but that means the other patients out of these 60 didn't have symptoms. They thought they recovered fully, and yet their heart had not yet recovered. It had some ongoing inflammation. So we do ask people to take it easy after COVID. And again, if you're an adult with congenital heart disease, first person you call if you get a COVID positive diagnosis is your primary care. But the second person is please call us, your adult congenital heart disease doctors. These long haulers or long COVID I referred to, what is that? So we call it post-acute. If after 3 weeks of having a virus, you're still feeling ill, that's not common. Most viruses will complete their course in about 3 weeks. Chronic is if it goes beyond 12 weeks. 10% of COVID patients probably have symptoms beyond 3 weeks. Those symptoms can be cough or shortness of breath or fatigue. It can also be headaches, GI upset, muscle aches, depression, and even difficulty concentrating. We do worry about inflammation of the heart muscle based on the study I just showed you. We worry about the actual heart muscle declining in function. And then there is a syndrome called POTS, which is an increased heart rate with minimal physical activity, a lot of dizziness and fatigue that we're increasingly seeing post-COVID, even in younger people. Being somebody with adult congenital heart disease, we do not know whether you are more likely than the general public to develop any of these things. So these are things that we've noticed in just everyone. Again, we'll still look at the longer haul in the ACHD patients who had COVID. So for adult congenital heart disease, what did I just learn in the past 2 weeks? So we did a study where all of us who take care of adult congenital heart disease patients contributed information about those patients who had COVID through an approved study. And that data was all correlated by Dr. Abelholsen and colleagues who shared the information with us. And what they learned is the following. Your adult congenital heart disease risk is not based on just anatomy. So you can't say, I have this disease, I have coarct, therefore I'm higher risk. I have Epstein, therefore I'm higher risk. We can't say that. But physiology matters more. So if you are doing less well, if you are less able to get around and do things because of heart failure, which we know increasingly might be a risk for doing worse with COVID. If you are somebody who has multiple comorbidities, kidney disease along with it, high blood pressure, obesity, that matters more than the actual name of what your anatomic disease is. What they did find is that most individuals with congenital heart disease did okay if they got COVID. However, those individuals who had Eisenmenger syndrome, those who have cyanotic congenital heart disease are blue or have low oxygen levels, and those who have pulmonary arterial hypertension, those individuals may carry higher risk. And so those are groups that, if you have those diagnoses, you want to reach out to your ACHD doctor. You also want to talk to them about getting the vaccine and getting it early. This publication is forthcoming shortly. We will make sure to have it up on the website with links to it and even a summary and explanation of it as soon as it comes out for everybody. We will continue to study those patients longer term to learn about that long haul and see how many of our patients bounce right back and how many still have some challenges getting back to normal after having COVID. So now, moving on to our next section, thinking about cardiac hospitalizations during the pandemic. So delayed presentations to the hospital. In March and April of 2020, there was a worldwide decrease in hospital admissions for heart attack. You would think that nobody was having heart attacks all of a sudden. What really was happening is there was an increase in out-of-hospital cardiac arrest because people were having heart attacks at home and they weren't coming to the hospital. Now, this is the older adult general population, but I will say we as adult congenital heart disease doctors were very worried that our patients wouldn't reach out to us, would be hesitant to come to the hospital to get care when they knew they might need care for arrhythmias, for new heart failure, for new symptoms. And we all made a very active effort, as you know, to reach out to you and even to use a lot of telemedicine, virtual medicine, video calls, phone calls, to make sure that we were staying in very close touch, even if at the time people were hesitant about coming to the hospital. Please also know that the hospital is sometimes one of the safest places you can be, because now, unlike back in spring of 2020, we have all the personal protective equipment we need. We have all the regulations right. We understand the virus so much better 1 year later than we did before. So that if, let's say, even now, there was a potential procedure you needed done, please call your adult congenital heart disease physician, speak with the team, and go ahead and plan it in the best time that you should be getting that. We don't want to delay our procedures for our patients when you could do worse if you delayed it. So again, it's a conversation that should be had. In late spring and summer of 2020, that's when a lot of late presentations came in. COVID numbers came down, patients started coming back. And I will tell you, August was a tough month because people were really sick and they had just hung on at home. And had we seen them sooner, they could have done better. So again, I say, please do report any symptom to your practice. The COVID pandemic in general has made patients reluctant to seek medical attention for acute cardiac care, but also other conditions, non-cardiac issues. So the American Heart Association, who we also collaborate with, has a Don't Die of Doubt campaign. And I thought this was really important, and I'd love for you guys to reach out and look at the videos. Don't Die of Doubt really addresses the fact that hospitals are still the safest place for you to be when you have a medical emergency. So calling 911, coming in if you have signs of heart attack or stroke are important. And specifically for our population, if you know that you are developing heart failure, if you have new volume overload, If you have heart rate or blood pressure issues, or if you think you might be having arrhythmias, those things for which generally we tell you, call us and come in, start with calling us. We may see you virtually and then bring you in. We may order testing and bring you in. And if you're not comfortable about coming in, tell us that too, and we'll reassure you or we'll work around it if you really have a lot of fear. These are symptoms of heart attack and stroke. Please remember, just because you are an adult with congenital heart disease, it does not make us safe from old person heart disease, unfortunately. It would be great to say you were born with one, you don't get the old person one, but we still do. So please remember that general older age things can happen to us. This is another case of an individual who was scared of the burdening healthcare workers. It's interesting. This happens a lot, right? I don't want to bother you. You're so busy with the COVID patients. I will just tough it out at home. That's not true. It's not a burden. And in fact, we want to see our patients when they have symptoms. So again, please don't say COVID's more important. I'll stay at home. You do need to call us. We do want to see you and hear from you. And then this is a great site still on that Don't Die of Doubt that talks about 5 reasons that hospitals are still the safest place to be. So if you're unsure, please come take a look. So in conclusion, having cardiovascular disease does not increase your chances of getting COVID-19, may increase severity if you get it, depending on what disease you have. COVID-19 can affect heart muscle and blood vessels. It can increase risk for heart attack, stroke, heart failure, blood clots, arrhythmias, and other complications. Recovery from COVID can be quick, but it can also take a long time. And we don't yet understand kind of long-term ramifications of cardiac disease. So as much as you can, mask up, keep socially distanced, have those Zoom parties, and try not to kind of go out there if you don't have to. If you do need to, please make sure to do it wearing a mask, even if you have been vaccinated with either 1 or even 2 doses. One thing I do want to bring up, it is really isolating to be almost at a year of COVID. It is hard. And if you don't have a little bit of anxiety because of COVID or a little bit of depression because of being isolated, I'd be surprised. I think all humans do right now. If you're worried that it might be a little bit more than that, please reach out to us. Let us know. We can definitely talk with you ourselves. We can even recommend therapists to chat with because really this is a tough time and it's not ending just yet. Lastly, the pandemic has definitely caused delays in care. So please don't hesitate to let us know that you're feeling unwell, and we will decide together with you what is most comfortable and safest for you in terms of getting appropriate follow-up. So my recommendations, maintain COVID-19 precautions, please, no matter what, for the rest of this year. Please vaccinate when you are able to, as soon as somebody offers it to you. Please continue to manage your existing cardiovascular conditions and really try and work on that healthy lifestyle. We all got a little lazy back in the fall and winter. And remain aware of concerning symptoms. Okay, so seek medical attention, not just heart attack and stroke, but anything else that may even make you feel that this is something I'd ordinarily call my ACHD doc for. If that's the case, then you should still do it today. It's our new normal. Thank you so much for having me. I'll stop here, and then I know that we'll kind of address some common questions. And Eric, maybe what I will do is I will take some of those more common questions and just kind of run through them. So one question has been, will we all really get vaccinated? And that question has come up several times. And so I think it's important to recognize that the country is doing its best to make sure to get all the doses of vaccine out there. There are questions, what if I get the first dose? Will there be a second dose for me? I think it's important to express if you're concerned about that. But yes, I think the plan moving forward should be one where if you get your first dose, you will get your second. Right now, we're recommending that you take the same drug both times. And so your doctors will offer you Pfizer and then Pfizer again, or Moderna and then Moderna again. We don't yet recommend taking one of one and one of the other. We don't know what that would do, and that hasn't been studied. So I think that's probably important to address. One other question that's coming up is if you are somebody who can stay home and you can socially distance and mask from others, should you delay longer in getting the vaccine to give it more time to have more answers? That's always a great question. However, I would say that now, with millions of doses having been given out, we will very quickly start to see trends. So when your opportunity comes as an adult with congenital heart disease to be given the vaccine, I would go ahead and take that opportunity. I think it's important. We're not going to change our lifestyle that much, but I think the anxiety of potentially getting the disease, or at least a severe version of the disease, will decrease significantly by that. We'll see if there are any other questions.
And so I assume that the message to the adult congenital heart disease patient who may be older is the same for the younger patient, the adult patient who is in his or her 20s, that the message is the same. The timing for the vaccine may be a little bit different, but the message is the same.
The message is absolutely the same. We have a lot of kids who are trying to head back to college, or even just, want to move back out on their own, having maybe moved in with the parents and bubbled with them. And I tell everybody, if we can stay masked, if we can keep socially distanced, then it is okay to try and do that. However, when your turn for the vaccine comes, definitely take it. And some of our younger patients may manage to actually be offered the vaccine earlier than they're suspecting. So they're not per se at increased risk just based on anatomy. Based on physiology, some patients may be offered it earlier. But if later this spring you get that offer and you're younger, again, please go ahead, take the vaccine, get the second dose, and still stay masked, and still make sure to socially distance. And similarly, when we're younger, we are maybe a little bit stronger. But if you have symptoms, just call and tell us. We're getting really good at virtual visits, and we can, FaceTime with you and make sure that everything's okay.
Well, the virtual visits have been terrific. And one other question that has come in, I think the younger patient has to pay attention, but now with the older patient and with the cold weather that we're experiencing in the Northeast, what are your recommendations for exercise for the congenital heart disease patient, and how can they keep active if it's a little bit harder to get outside and do things?
Absolutely. That's a great question. So when we're thinking about exercise, a few things. One is going kind of old school and using the television. There are a ton of exercise programs, but online there are so many different exercise programs that you can embark in that have adjusted themselves to be indoor COVID programs. So by all means, if you can afford and have a Peloton or a mirror or things like that with a prescription, that's great. But if you don't, you can really kind of get onto YouTube, find some kind of reasonable looking exercise regimen and try them. Now, note to self, don't go crazy. And so I think finding, reasonable regimen that look like the kind of exercise you would do if you were outdoors and it weren't COVID. I think that's really important to start at a level that's comfortable for you and then work your way up from there. But by all means, things in the house make a huge difference. If you have stairs, that's always a nice way to exercise. If you have access to a treadmill or a bike or anything else like that that gives you aerobic exercise indoors, that's great. And even with cold weather, bundling up, the mask actually helps a lot with not getting that cold air grabbing your lungs, and going out for a brisk walk or run is still a great idea.
Mask does provide some warmth on those winter days with walking the dog.
Yeah.
Well, that is wonderful. I don't think there are any more questions that are out there, but the presentation is meaningful and very important at this time, and very reassuring to patients as the vaccine is coming out, and I think encouraging patients to contact their primary care doctor and their cardiologist is an important message for all.
Absolutely. I think a few things moving forward just for the audience is we will definitely try, I think, Eric, and put the new trials and the ACHD relevant research up on the website with a summary for you so you can take a look at it. So just keep coming back and we'll get that out to you. And again, if you do want to talk more and have more specific questions about the vaccine or COVID or the process, always reach out to your local doc, but feel free to reach out through the website or over to us, and we can always just do a virtual education session for you and answer your questions if you're watching this at a later time from today.
Thank you very much, Dr. Bott.
Absolutely, my pleasure. Take care, everyone.